Hello, good morning to everyone. I am Sajjad, General Surgeon and student of CTM PhD. My major advisor is Assistant Professor Prakikewa Charavatana. My research topic is the usefulness of ultrasound for case management in liver head disease. It is a cross-sectional study in Jalalabad city, Afghanistan. Introduction in epidemiology of Echinococcus hereditary disease is a worldwide zoonosis caused by the larval stage of Echinococcus tapeworm. As we know, there are many types of echinococcus in the world, but the two types are common cystic echinococcus and alveolar echinococcus. Cystic echinococcus, which form cystic lesion in many organs of the body, like they are involved liver about 75 to 80%, lungs about 15 to 20%, and other organs about 5 to 10%. This disease is endemic in many parts of the world, like we can see in the map. The purple color countries are high endemic for both types, cystic echinococcus and alveolar echinococcus. And the dark green color countries are high endemic just for cystic echinococcus. Afghanistan is also located in high endemic area of cystic echinococcus. The light green color countries are endemic for cystic echinococcus. In the white color countries are non-endemic for the cystic in alveolar echinococcus. Thailand is also located in non-endemic area for cystic echinococcus and alveolar echinococcus. As we know, Afghanistan is an underdeveloped country affected by war, and from epidemiological distribution, Afghanistan is located in a high endemic area for the cystic echinococcus. But unfortunately, our Ministry of Public Health still don't have any data in any study about echinococcus. And also they don't have any control program in any screening program for the early detection and early diagnosis of echinococcus. So for this reason, more patients came to hospital with dangerous complication, which leads to cause of death in echinococcus. We can see in this video from my experience in the Uzay Medical Complex. Uh, so for these above mentioned reason, I have choose their topics for my study. We have many government and private hospital in Jalalabad city. Just in our hospital in the Uzay Medical Complex in Institute, we operated about 32 patients of many organs like liver head disease, spleen head disease, lung head disease, kidney head disease in last year. These patients from our hospitals. Hypothesis of my study is staging liver head disease using ultrasound useful for case management. Can we predict the treatment using information from ultrasound and liver head disease? Primary objectives to study the staging of liver head disease using ultrasound compared to CT for case management, to study the clinical and laboratory characteristics of liver head disease related to treatment. Secondary objective to compare the staging result of imaging using ultrasound, CT scan, and liver head disease to observe the complication after treatment and prognostic factors. My sample size is from this formula about 159 patients. Material and methods. Study design is a prospective cross-sectional study, and study place is the Uzay Medical Complex, which is a medical institute located in Jalalabad city of Afghanistan. Study population are all liver head disease cases diagnosed by ultrasonographic center in Jalalabad city of Afghanistan. Inclusion criteria for this study: all age and both genders, liver head disease patients with diagnosed by sonologist in Jalalabad city of Afghanistan who sign informed consent. Inclusion criteria: patients who have past history of liver head disease surgery and treatment with medication, and patient with hepatic alveolar echinococcus and pregnant women. This is a schematic diagram for my study. in a short video for data collection process. As we knew, about 66% of liver heresies are asymptomatic and diagnosed incidentally by sonologists. In our city, we have about 10 diagnostic ultrasonographic center, which are registered with Ministry of Public Health. They will inform me about the cases. In my trained person, MD doctor, my trained person, MD doctor will describe the study process to the patient. After agreement, the patient will come to Dawood Medical Complex, like we can see in the video. After the patient came to the medical complex, meet with me in my MD doctor. MD doctor will describe participant information sheet. In after consent, we will take a history, physical examination, and filling CRF. Then the patient will go to for re-abdominal ultrasonography, CT scan, and lab investigation. After to complete the investigation, I will select the best option for the treatment according to the treatment guideline. At the end of data will be storage in Nangarhar Medical Faculty Ethic and Research Committee. Significance of the research will be this study will identify the role and usefulness of ultrasound in the staging and treatment of liver heresies and will prepare more information for sonologists, medical practitioners, and surgeons. It will also compare the ultrasound with CT and liver heresies and will be found that when and where we should use ultrasound and CT scan. According to the image in lab findings, this study will suggest good treatment methods for liver heresies. All above mentioned suggested findings will be shared with Ministry of Public Health of Afghanistan to justify through national health policies for application. And the result through the Ministry of Public Health social awareness program, people will know and learn the cystic echinococcus sources, risk factors, and transmission routes. Thank you so much from all participants.